Hello, my name is Caitlin Connor, and today we're going to be discussing SVT, which is supraventricular tachycardia. This means a fast heart rate that is originating somewhere above the ventricles. And this is categorized as a heart rate above 100 beats per minute sustained in a resting adult or greater than 200 beats per minute sustained in a resting neonate. This is generally a benign finding and has isolated incidences or something that will be outgrown by a neonate. This is a type of arrhythmia. Signs and symptoms that you might see for both adults or neonates is going to be chest pain, obviously the increased heart rate, palpitations, dizziness, and syncope. Now, with a neonate, you can't ask them about their symptoms, so the only real thing that you might see is going to be that increased heart rate while they're resting or sleeping or just laying there being happy. If a neonate has prolonged SVTs, you can expect to see things like fatigue, shortness of breath, and poor feedings. So for comorbidities, there really aren't any for adults. However, for a neonate, you might look into a congenital heart defect if it hasn't been detected yet. It can also be associated or something that's caused by heart surgery or heart-related procedure or a central line placement such as a PICC line. The pathophysiology behind SVT is essentially electrical impulses or pathways that are causing the heart to beat faster than it needs to. The cardiac demand just isn't there and the heart is beating faster and, circulating blood faster than it needs to in order to oxygenate different organs throughout the body. So there is still a PQRS-T wave in the EKG when a patient has SVTs, and the heart rate is still at equal intervals. It's just fast. So ways to diagnose SVT is going to be through an EKG or an echo, and that has to be done during an event, which can be very challenging, especially for someone who's not in a hospital setting. A lot of the times when this actually gets captured, it just happens to be that the patient is in the hospital hooked up to a cardiac monitor. So some of the ways that you can treat or manage SVTs, like I said, it's kind of an isolated incidence and it really doesn't cause any bother to anyone. So sometimes it resolves itself. If it doesn't, you can do things such as the Valsalva maneuvers. So vagling yourself by either gagging or coughing. You can also incite the dive reflex by putting ice on your forehead or the bridge of your nose area, or putting your face into a bowl of cold water, or splashing yourself with ice water. All of those will incite that reflex and hopefully pull you out of SVT. It's kind of like a reset button. If those ways don't work, you can move on to some other things that would require, medical attention or like a hospital. So giving the medication adenosine through an IV push, that has a very short acting half-life, but basically you'd push it, it'll stop the heart rate, and then it'll hopefully pick up in a normal rhythm that's not greater than 100 or 200 beats per minute. You can do a couple rounds of that. If that doesn't work, then your next bet is going to be cardioversion or ablation or medications. So some differential diagnosis for neonates is going to be hyperthermia or infection, and then differential diagnosis for adults is going to be caffeine or illicit drugs, or you might want to look into, is it reactive hypoglycemia. So just to recap, we discussed SVTs, which is a heart rate greater than 100 beats per minute sustained at rest in adults, or greater than 200 beats per minute sustained at rest in neonates. And that's all. Thank you very much.